to today's webinar sponsored by HUD's Office of Community Planning and Development, or CPD. My name is John McGaugh. I work at the National Center on Family Homelessness, and I'll be the moderator for today's webinar. On behalf of CPD, I would like to thank all of you for joining us. Today's webinar is the Consolidated Plan Template 2, How to Prepare Your Consolidated Plan Using IDIS Online. Now, this is a follow-up to the webinar, How to Use the Consolidated Plan Template on IDIS Online, presented on May 16, 2012, and available on the OneCPD Resource Exchange website. Just click on Learning Center, then ConPlan Training. Before we begin, I would like to make some logistical announcements. One, today's webinar will last approximately 1 hour, and the webinar is being recorded. The recording and the PowerPoint presentation will be posted next week on the same ConPlan Training page. As an attendee of this webinar, your microphone will be automatically muted. Please listen to the presentation through your phone for best results. The call-in information has been sent to you and is also listed in the upper left-hand corner of your meeting room screen under Audio Instructions. Another option is to use your computer speakers, and this requires that you turn on and turn up the speakers on your computer. Now, due to the large number of attendees, there may be a slight delay in the advancement of the slides. This webinar will include website demonstrations. To enlarge these demonstrations, simply click Full Screen in the upper right-hand corner of the demonstration window, and clicking Full Screen again will resize the window. If you experience any other technical difficulties, please let us know by using the Q&A box on your screen. You may also submit content-related questions using the same box, and we will try to address them during the presentation. Immediately following the webinar, you will be directed to a satisfaction survey. Participants are strongly encouraged to respond to the evaluation to inform the delivery of future webinars. Now, today's webinar will feature the following presenters: Caitlin Ott, Assistant Project Manager, and Meg Barclay, Project Manager, both of the CPD office. And now I'd like to pass this over to Caitlin to begin the presentation.
Thank you, John, and welcome everyone to today's webinar. As John mentioned, today's ConPlan template webinar is a presentation that will build on the first Consolidated Plan template webinar held on May 16th by demonstrating additional features of the Consolidated Plan template in IDIS Online and reviewing how the template has been designed to help grantees meet regulatory requirements. Today's webinar will provide a background on the Consolidated Plan template in IDIS Online, which is one component of the eCon planning suite, and review what we went over in the orientation webinar on May 16th. We'll also demonstrate how to complete the screens in the needs assessment, market analysis, as well as the structure of the strategic plan, including the connection between the anticipated resources, geographic priorities, priority needs, and goal screens. And at the end of the presentation, we'll provide links to key resources. There will also be references to the desk guide on each demonstration slide, so if you'd like more information about anything we cover, you can just refer to the desk guide on those pages and learn more about those screens. Please send your questions throughout the presentation in the questions box. We may answer some of the questions during the presentation if there's a pause as we move from screen to screen in IDIS, but the majority of the questions will be handled at the end of the presentation. We will be compiling all the questions and answering them aloud for everyone's benefit, so only technical questions regarding the webinar will be answered through the question box. The eCon planning suite was designed to support need-driven, place-based planning and is comprised of 3 components. First, HUD has assembled an expanded database with planning data that speaks to all uses of the Consolidated Plan grant funds. Second, we have built CPD Maps, which is a user-friendly website that makes data accessible and easy to understand and manage by grantees and the public alike. CPD Maps provide several mapping tools to analyze, compare, and display conditions throughout the jurisdiction or state to support place-based decision-making. And then what we'll talk about today is the Consolidated Plan template in IDIS Online. HUD has designed a standard electronic submission template for the Consolidated Plan that can be completed by grantees themselves. This template provides greater efficiency, and by being incorporated into our grant and reporting system, goals in the plan can be connected to activities and outcomes that are reported in IDIS. The Consolidated Plan template in IDIS Online integrates the components of the grant management cycle into one cohesive planning framework within one system. Data is incorporated into the template to support data-driven assessment of needs and market conditions. Also, by incorporating the ConPlan into IDIS, goals that are set up in the 5-year strategy and in the annual action plan can be compared against the activities and accomplishments already being reported in the system to make year-end reporting in the Consolidated Annual Performance and Evaluation Report, the CAPER, or the PER for states, the Performance and Evaluation Report, more efficient. Further, the design of the ConPlan template in IDIS supports the efforts of grantees to enhance their local planning processes. The integration of data and maps from CPD maps allows for targeting based on an analysis of place-based data, both community-wide data and by specific target areas at the neighborhood level. The structure of the template facilitates consultation with community partners and a more meaningful citizen participation process around community needs, and provides a framework for incorporating leveraging of public and private funds and to align priorities between private funds and ConPlan grant funds. So the template has been designed to meet the unique needs of different types of grantees. The standard template is for entitlement grantees, or PJs. However, the system also accommodates consortia plans, state plans, and regional strategies. These plan types are available on the administration screen 8025, which you set up when you add a plan. For consortia plans in the system, the plan would be added by the lead grantee, who must specify the participating grantees and the types of programs that each of them administers. Once the plan is saved, the system will create a template for the consortia plan as a whole for the lead grantee, and will create non-housing community development plan templates for each participating grantee that receives CDBG. All of the templates will have the same version and title, except that the titles for each participating grantee will include the name of that grantee. The lead will be preparing the plan for the consortium as a whole, while the grantees receiving CDBG will complete those templates for the non-housing community development plan. Participating grantees will be able to view and edit the plan for the consortium as a whole, but only the lead grantee will have the ability to submit the plan. The lead will also have view access to those participant non-housing community development plan templates. When the lead and the participant templates are complete, the system will compile the plans for the consortium as a whole and those templates for the non-housing community development plans of each participating grantee, and they will be submitted together by the lead grantee. The template for states will work in much the same way as the template for entitlement grantees, or PJs. However, the template is based on the regulatory requirements for states and accommodates that method of distribution in the annual action plan. In addition, the 4 border states have special questions that are related to their colonial set-aside that they will have to address to meet regulatory requirements. A regional strategy allows multiple grantees to jointly develop a 5-year strategic plan for a region. Each grantee is responsible, though, for their own action plan and for administering their own grant. The regional element of the plan is thus limited to the needs assessment, the market analysis, and the strategic plan, which is that 5-year plan. In the system, one grantee will be designated as the lead and will add the plan. When adding the plan, the lead will identify all of those participating grantees that they're working with. Default data for the needs assessment and market analysis tables, which will pre-populate those tables, will display aggregate data for all of the grantees that are participating in the plan. Once the plan is added, the lead and participating grantees will have the same editing rights and view rights, but the lead will submit the plan when it's completed. So as a reminder, the topics we covered on the first webinar of the Consolidated Plan template held on May 16th were how to get started in the system by gaining access to IDIS and acquiring privileges to the Consolidated Plan module and CAPER modules. Also how to add a plan to the system. And we went over how to use the technical features of the template, including simplified data collection, viewing default data and editing that data with alternate data sources, customizing your plan using maps, data, images, and additional text insertions throughout, and then the connection between the screens in the strategic plan and the annual action plan. We also concluded the presentation with instructions on how to prepare your plan for submission, including reviewing quality checks, printing a Word version of your plan for citizen participation, and changing the status of the plan to ultimately submit the plan to your field office through the system. So if you have any questions on how to go about doing any of those functions in the system, you'll want to review the May 16th webinar that's posted on the OneCPD Resource Exchange. I'm now going to move towards the demonstration part of the presentation. So you may want to begin submitting questions if you haven't already, as we may have a chance to answer several while we're moving between screens and IDIS. In order to see the presentation clearly, you may also want to switch over to that full screen view that John mentioned earlier. The view will cover the questions box, so if you'd like to submit questions, you'll need to make sure that you turn off the full screen view, and then you can click back and forth between full screen and between the regular view. Now on May 16th, we covered the setup, the consultation, and the citizen participation screens, so we'll start today with a demonstration of the screens on the needs assessment that may require further explanation. The first screens that we're going to cover are the disproportionately greater needs screens, and now I'm going to switch to the demonstration. This will open the disproportionately greater need housing problems screen. In these three disproportionately greater needs screens, the default data was programmed incorrectly. There was a mistake in the coding that we've recently fixed, so we wanted to point it out for you today. If you've noticed any issues with this data, you can always add a new version of your plan in the system, and you'll see the corrected data. However, if you've already entered a significant amount of information in the current plan version that you're working in, and you do not wish to transfer all of that information to a new version of the plan, you can contact the ConPlan mailbox, which the email address of the ConPlan mailbox is conplan.mailbox@hud.gov, and it will be available on the last slide of this presentation. But you can contact that mailbox, and we'll work with you to update the data in your current plan version that you're working in. I just want to warn you that this may take several weeks to accomplish, so your best option is to add a new version of the plan to the system. So getting started on the disproportionately greater need screens. A disproportionately greater need exists when the members of a racial or ethnic group at an income level experience housing problems at a greater rate, at least 10% more, than the group as a whole. For example, if 60% of all low-income households within a jurisdiction have a housing problem, and 75% of low-income Hispanic households have a housing problem, in this case, the low-income Hispanic households would have a disproportionately greater need. So this section of the template includes 3 screens, and they capture the number of housing problems, such as the screen we're on. There's another screen for the number of severe housing problems, and a third for the housing cost burden. And these problems are shown by income and by racial or ethnic category. There'll be several tables on each screen, which are data by different income categories. We have 0 to 30% of area median income, 30 to 50% of area median income, 50 to 80, and 80 to 100%. Now, HUD has pre-populated these tables with data, but you'll need to do the calculations to determine the percentage of housing problems being experienced by each group and whether or not they're disproportionately affected. And I just want to point out quickly that some of the data citations on our screens are incorrect, and we're aware, and we're going to be fixing that shortly. Right here, this is CHAS data, not PH Information Center data. So to calculate the percentage for each group experiencing housing problems, what you would want to do is divide the number of households in that racial or ethnic category, for example, white right here, by the total number of households in that racial or ethnic category within that income level. In order to calculate the total number of households in that racial or ethnic category, you'd need the sum of all 3 columns here. I'll slide this over. So you do the number of white households experiencing 1 or more housing problems divided by the sum of white households with housing problems, without housing problems, and with 0 or negative income. You'll then need to compare the percentage of each group experiencing the housing problems to that percentage for the jurisdiction as a whole to determine whether there's a disproportionate need. And for the purposes of the demonstration, I've developed an example, as I just mentioned. So here you can see for the white racial group, we take the number of white households experiencing a housing problem, and we divide by the sum of white households with a housing problem, without a housing problem, and with 0 negative income. And we get 75.93%. We've done the same for the jurisdiction as a whole, and you can see the result here is that we are not experiencing disproportionately greater need for the white households in this community. I'm going to move on to the homeless needs assessment. Throughout the template, in the homeless needs screens, there's homeless needs screens in the needs assessment, and then there's homeless facility screens in the market analysis section. HUD is not able to pre-populate the data for these data tables. And the reason that we're not able to populate that data is that the continuums of care are responsible for the inventory and the point-in-time counts for the larger continuum area. So, okay, I'm being told that we're having some technical difficulties right now, so I'm going to move to answer some questions until we get the webinar back up and running so that you can see the demonstration that I'm providing. So the first question I have is whether or not a user can upload their own data into the CPD map site or only into the IDIS ConPlan template. You're not able at this point to upload your own data into the CPD map site. We do have the HUD data that's available in the CPD map site available through map service. So if you have GIS capability, you'd be able to pull that data for the locations of HUD housing investments into your own GIS software. But you can, as was mentioned here, import your own data into the IDIS ConPlan template by using the insertion point to add a data table, which is right here. So then we have another question about when we'll be required to enter plans into IDIS. So you're not required to use the system to enter your ConPlan until your next 5-year strategy is due. And the first grantees that will be required to do so will be those that are submitting on or after November 15th of this year, 2012. However, there is an option for submitting your action plan in the system before you have a consolidated plan that's in the system. And actually next week's webinar will address that, and we'll address what types of information from your current approved paper ConPlan would be required to be submitted, to be entered into the system in order to make that possible. It's a minimal amount of data to make that connection between the ConPlan and the action plan. I have some instructions. Sorry, this is Meg Barclay. We have some instructions for how to get back into the webinar, so we're going to do that now. We'll be back up and running in a minute. We're just going to wait for confirmation that we are sharing our screen now. And then we'll move forward with the presentation. Okay, so we have confirmation that everyone can see my screen again. And as I was mentioning, these tables on the homeless needs assessment screens are not able to be pre-populated with HUD data because this data is collected by the continuums of care. They're responsible for inventories and point-in-time counts. And so they'll need to break out the data and inventories and provide those to the ConPlan for the ConPlan jurisdiction area. So HUD is suggesting at this time that grantees consult with their continuum of care to obtain the data that should be attributed to the ConPlan jurisdiction for the tables in these homeless screens. There's tables here in the homeless needs assessment, again, and also in the homeless facility screen on the market analysis section. However, HUD is working on guidance for the 2013 point-in-time counts to help continuums of care to attribute homelessness data to specific ConPlan jurisdiction areas within their broader continuum area, and they'll begin collecting data in this way. So when that data is available, we will also be able to pre-populate these tables here in the Consolidated Plan template. Next, I'm going to move on to the non-homeless special needs screen. Notice that the sample grantee that we're using right now is a HOPWA grantee. So we see the HOPWA tables on this screen. However, these tables will only appear for grantees that receive HOPWA. Because HUD does not have additional data on the needs of special needs populations, grantees will just have to describe these needs in narrative fields and discuss how they determine those needs in order to fulfill the regulatory requirements. You can see the questions down here. Consultation with service providers should be helpful in determining those needs of special needs populations. Also, if you have any survey data on the needs of those special needs populations in your community, you can insert additional data table, as I mentioned before, here, and then discuss how that relates to the plan. And the last screen we'll look at in the needs assessment is the non-housing community development needs screen. Here on the non-housing community development needs screen, information collection has been simplified from what we had previously to general categories of CDBG activities in order to fulfill the regulatory requirement to talk about your needs by type of CDBG activity. Before we used matrix codes, which can be a bit tedious, and we thought that it would be, it makes more sense to talk about general categories of activities at the 5-year planning time of because you may not know what specific activities you're carrying out at the time of the 5-year plan. All of our non-housing community development data, such as economic development data, is displayed on our non-housing community development asset screen in the market analysis section. So here, you'll just fulfill the requirements by providing the narrative. And again, you can always add additional maps, text, table, if you have anything locally that will help you to fulfill these requirements. And now I'll move on to the next slide before moving into our next demonstration. Together with the needs assessment, the market analysis, will provide the basis for the strategic plan and the programs and projects that will be administered throughout the planning period. Most of the data tables in this market analysis section will be pre-populated with default data. There will also be narratives, much like the screens in the needs assessment. So in the interest of time here, I'll just cover a few of the screens that may require additional guidance. And we'll move back into IDIS for a demonstration. And the first screen that we're going to look at is the public and assisted housing screen. At the top here, the first table, the total number of units table for units of public housing or vouchers available, is pre-populated with data. This will only be available if you've added public housing authorities on the administration screen AD 25. Otherwise, this would be blank. So if you're not seeing data in your template, you'd want to go back to AD 25 and ensure that you've added PHAs. Again, the data source is incorrect here. This is PIC, Public Housing Information Center data, not CHAS data. So we'll be correcting this shortly. And as we move further down the screen, this public housing condition table, we're not able to pre-populate with data at this time. Also, this table does not appear in the state template, but entitlement grantees and PJs will need to obtain public housing physical inspection scores to complete this table. You should consult with your local PHA to obtain average inspection scores for each public housing development within your jurisdiction. And then to add the public housing development to this table, you would just add another. And then you would name the public housing development. And then you would enter the average physical inspection score for that development. And you want to make sure that you save all that data before you move off the screen, before you add any insertions, because it may be lost. And we do want to say that as a future enhancement, we hope to be able to provide this data pre-populated in the template for you. It's just not available at this time. Other screen that I want to cover today in the market analysis is the needs and market analysis discussion. This screen is just a series of narrative text fields, and these discussion questions are designed to help grantees assess their needs versus their market conditions in order to develop a set of priorities to be addressed over the 5-year planning period and design strategies for those priorities. When answering these questions, it may be useful to have a printed version of your needs assessment and the earlier screens of your market analysis for reference when you're making these assessments. And with that, we'll move back to the slides before continuing our demonstration. The last section of the plan that we'll cover today is the strategic plan. When developing the strategic plan, it is recommended that you complete the screens in order as the earlier screens build towards developing your goals. As I'll demonstrate next, the data on these screens is connected so that data entered in the anticipated resources, geographic priorities, and priority needs screens will appear as options in menus on the goal screen. Next, we'll move into a demonstration of the screens in the strategic plan in IDIS. The first section that I want to go over is the geographic priority screen. And we do actually have a question while we're waiting for the screen to load about whether or not there's a field for neighborhood strategic revitalization areas. And you'll see that here there is. The regulations do require that grantees discuss the basis for allocating their investments geographically. And so what we've done here in the template is, in addition to providing this narrative question about why you've allocated your investments geographically, we've also allowed grantees to add target areas or add current neighborhood revitalization strategy areas that they have, which can then be assigned to goals and needs to show how you're allocating your investments. As I mentioned, target areas that were previously added to the system, such as approved NRSAs, are listed here. And as we scroll over, you would just check which ones you want to include in your plan. Any that are listed on the screen that you don't check will not appear in your printed plan. And you can also add new areas, strategy areas, just local target areas that you plan to target funds to, other types of areas. We've added a couple areas right here, just in the purpose of time. So I'm going to just take a look at the summary to show you what kind of questions you would have to answer when you enter a target area. You'll name your target area, and you'll answer some questions about what type of area it is and the percent of low mod there. And then you'll just answer some background questions about the needs and market conditions in that area and why it's relevant to your plan. As you can see here, the boundaries of the neighborhood, specific characteristics, commercial characteristics of the neighborhood, or housing characteristics. We'll just return back to the main menu now. And you'll see in later screens how the areas that you set up here on the geographic priority screen form a menu on later screens to be chosen to be assigned to needs and to be assigned to goals. And I'll demonstrate that right now in the priority needs screen. Again, we've added some priority needs ahead of time just to save a little bit of time here. So we have 3 that we've set up, and I'm just going to go ahead and click Edit to see how we created them and what kind of information is associated with each of those. Okay, so first of all, you can see that priority needs are defined both by the grantee in terms of what they name the priority need and how they describe that priority need, and also in terms that are meaningful to HUD in these categories which are called out by the regulations for the certain populations that will be addressed. You can see that grantees may check more than one population, which allows for flexibility in terms of being more general or more specific about your need. As I had mentioned, the target areas that you set up are available here. You may include them, but you don't have to if the need is more of a general need that you want to address jurisdiction or statewide. And then also you see here, since we've already set up a goal, the associated goals are already available in the priority needs screen. The priority needs will also be available in the goals screen, so it works both ways. And I just want to quickly show you what the priority needs will look like in a printed plan. Once you set them up, we have a table that just sort of organizes graphically those needs, so it's easy to consume the information. We have each of the 3 needs that were already set up, the priority level, and then the populations that they're addressing, as well as any goals that were set up that they're addressing. And next, I'm just going to go into the anticipated resources screen. Regulations require the plan to identify federal, state, local, and private resources expected to be available to address the priority needs and goals in the plan. So the template is designed so that the Consolidated Plan grants that the grantee receives are already populated in this table. The grantee would just enter the expected amount available. But also it allows for grantees to add additional public and private leverage funds to show how these funds, and to show how these funds can be used in conjunction with the ConPlan grant funds by adding uses of funds and how they may be used together to accomplish their goals. So we have a narrative field which asks how the federal funds will leverage additional resources, and you can describe that here. But by adding these additional funds to the table and then also assigning them to goals, you can show how you're leveraging resources to meet specific goals. All the funding sources that you add here will appear in a menu in the goals screen. Next, we'll look at the institutional delivery structure. Where grantees will add organizations that carry out the plan. They may include grantee agencies, departments, other government agencies, nonprofit organizations, developers, conditions of care, or other types of entities, and you can see a menu of the types of entities you might include right here. This screen is an example of how the template provides a simple table to collect information graphically so that you don't need to provide a lengthy narrative to explain something like your institutional structure, and you can fulfill regulatory requirements by filling out this table. Grantees are not required to specify every organization that will be involved in the program delivery, but at a minimum you should identify the lead agencies and other organizations that will play a major role in administering funded activities. Here we've added 2 organizations already and named the type of agency they are, the role they have in the plan, and then also whether or not they serve a specific geographic area, the region, the jurisdiction, perhaps a specific target area you had already identified. And I'll also show you how to add another organization. You would click Select Organization, and here you can either search from existing organizations or you can add organizations that are not currently in the system, and you would just name them, and then they'd be saved in IDIS for your next plan. So here, we'll look for an organization that's already in the system by a search term. And we'll say that I want to add this Housing Development Corporation. And you would click Select. So now it's been added to the table. And I'll say that this is it's private industry, but they do both types of affordable housing development. And they serve the entire region. And you can keep doing that until you've added all the agencies that have a major role in administering your plan. As we scroll down a little further, we have another table that will collect information in a simple way where HUD is not able to provide any data. So here we're fulfilling the requirement to talk about the availability of services targeted towards homeless persons and persons with HIV, as well as mainstream services. So we have a list of types of services, and all you have to do is go through and check which services are available in your community. And you can add additional services. And then below you can talk about strengths or gap in your service delivery system and identify where some of these spots where you haven't checked, whether or not there's a need for that in your community. And again, I just want to show what this will appear as in the printed report. Here at the top, we show the responsible entities for administering the plan, and I printed this out earlier, so we have the two that we already entered before the demonstration and the type of entity, their role. And down here we have the table that shows the availability of services. And you can see here all of the types of services will show up and whether or not there's a check so that you can see where there's gaps. But up above, only the information that you actually enter or check will show up in the printed report. And the last screen that I want to look at in this demonstration is the goal screen. Previous screens, we've already added a goal to this sample plan. So I'll open that goal up. Again, you can see that you are able to name the goal whatever sort of name is meaningful to your programs and describe it in a way that would make sense to you, but then identify the category one of the categories that's called out in the regulation. So you're fulfilling that regulation to talk about how you're addressing affordable housing, public housing, homelessness, etc. Again, when setting up goals, it may be helpful to print out earlier parts of your strategic plan to be sure that you're addressing all of the priority needs that you have identified. But those needs do appear in a menu so that you can assign a need to a goal and show how they're connected and how you're addressing all of your needs. The same goes with the funding that you have available. And down here, we have a list of goal outcome indicators, the quantity that you expect to accomplish over the planning period, and the unit of measure. And it is important to remember that the goal outcome indicator you choose here will help you to track your progress against your goals in your CAPR. So these goal outcome indicators will automatically populate your CAPR, as well as the activities and accomplishments you report in IDIS, and they'll be compared against each other. And with that, we'll go back to the slides. So here's a summary of key resources, which you can actually click now on the screen or review later when the slides are posted online on the OneCPD Resource Exchange. And I think that we have a number of questions that have come in that we can begin to answer now, because that concludes the demonstration portion of the presentation. So the first question is, what happens if you don't do any public housing? Well, one of the requirements of the ConPlan regulations is to talk about the needs of public housing residents. So even if you as a grantee do not do your own public housing, you should consult with the PHA in your area to see what the needs of public housing residents are. If by some chance there are no public housing developments anywhere within your jurisdiction, there are no public housing residents, then you would address that in the plan in the questions. That there aren't public housing residents, there isn't a need, they don't have a need. Let's see.
We had a question about PHAs gaining access. This is Meg Barclay. A question about PHAs needing to gain access to the system to help complete those parts of the plan. That's really at the discretion of the grantees themselves. In the May 16th webinar, there were instructions for requesting access for staff and partners to IDIS. If you would like to provide access to IDIS for your PHA partners to be able to complete those portions of the plan, you can do that. You can also restrict their privileges to the consolidated plan only so they can go through the screens. They can learn about the screens from these webinars as well. And
we have another question about if our housing authority is Section 8 only, do we put in the physical inspection scores they have for their voucher-funded housing? No, this table that we've set up is just for the physical condition of public housing units, not for voucher-funded housing units. I have a question about my comment earlier that you can use the system to submit your next annual action plan. And the question is, can you use it to submit an amendment as well? You'd only be able to use it to submit an amendment if you already have an approved ConPlan in the system. So once you use it for the first time for your 5-year consolidated plan, you'll then be able, or annual action plan, you'll be able to make amendments to the ConPlan using the ConPlan that's in there, altering it. You would change the status to have your field office review it again. That's how you would submit amendments. But you cannot submit amendments on paper-approved ConPlans using IDIS. We have another good question about whether or not you can have an NRSA approved through the ConPlan template in IDIS. This is something we actually talked about, and we haven't implemented it yet, but we expect a future enhancement to be including the questions you're required to answer when you get your NRSA approved, to put them in the template in IDIS so that you can easily input that information into the system, send it off to the field office and have them approve it that way. But currently we don't have that functionality.
A question about when adding agency names, that there are many records for, if there are many records for one agency, which ones do you use? That's at your discretion. That's one of the issues with the organization database in IDIS, that there are sometimes multiple entries for the same organization. Obviously, it's best if you pick one and use it going forward, but that is up to you.
I have another question about whether or not you can begin to input data early. For example, if you have a consolidated plan due in 2014. You can begin to input data early if you watch the May 16th webinar about how to add a plan, you'll see that you are able to put whatever year your plan is due in as the start year, so you could put 2014. However, as we make updates to the data, for example, when new ACS or CHAS data is available this summer, the version of the plan that you've started won't be updated. Just like when I mentioned the update to the disproportionate needs data, the error that we found and corrected, how you would have to add a new version of the plan in order to see that new data. The same would go as if you started your plan early and we update with brand new data, because we want to keep it the most updated data possible. You wouldn't have that updated data in your template. So what you may want to do, I know that a lot of grantees will probably be filling out their plan, will be printing a paper copy and working through their plan in Word, and then going back when they know that they're set to input their data and narrative into the system. You can always print out that now, and then you can at least get started on what the process is, get any sort of consultations that you want to get started now. and start thinking through that process of preparing your plan in the new format. Is there a practice site where IDIS site users can practice writing and creating a consolidated plan? There is not a practice site. However, you can create as many versions of the plan as you'd like. So you can create a version and then not submit it. So you can create one, you can call the version practice plan. Your field offices do not have access to those plans until you give them access to the plans, either by allowing them to review your draft plan or by submitting the plan. So you can do as many practice plans as you like just in the regular system. I need to enter an annual plan data for previous years and the CAPER data for previous years approved CAPER. You will not need to do that. You will just use, once you start using the system, you will just enter your current data and use it going forward.
I think the answer also, you can't use the system for your CAPER until you have a completed and approved annual action plan in the system. Also, it's important to clarify that.
Is it anticipated that this tool will be used for draft plans to use for public hearing process as well as the final approved document? It is anticipated that you would do that. You would be able to print out a plan in a Word version in order to use it for your public participation process and to post it. And we went over that in the May 16th webinar, so if you have any confusion about how to download the plan, you can take a look at that. You can also look in the desk guide, which is available here on the key resources page. And it explains how you can either download the entire plan or even just sections of your plan, which would be faster.
And to follow up on that as well, once a plan, so you can use the Word version that you download from IDIS to publish your plan for public comment, but once the plans are approved in the system, we'll also be posting them on HUD's website. Yeah, I just said that. Okay, we have a question also about, this is sort of a technical question about the length of the plan in the template, whether or not, or why the template will only or restricts the years that you can use. It's a 5-year inclusive plan, so it looks like 4 years, but for instance, the example that we got in the question was the first year is 2013, but the option can't be extended later than 2017. But so a plan that starts in 2013 includes 2013, 14, 15, 16, and 17. That would be 5 years. Just a real easy technical question. And another one about a strategy that's going to be submitted in the next week or so. And does that mean that you're not required to submit or use the planning suite to submit your plan until your next strategy is due? That is true. That's outlined in a notice describing the new template and the new requirements that is also posted on the Consolidated Plan website.
We have a question that says, we are a CDBG entitlement community, part of a consortium for home funds. How do we submit a plan for our home portion? Many of our goals overlap. So this goes to the description I gave earlier about how consortia plans work in the system. The lead grantee for that home consortia would open the plan and they would designate you as a participant, CDBG participant community in the plan. So you will see a template when you go into IDIS that covers that non-housing community development plan for your CDBG grants. And you would work with your consortia on the rest of the plan, which covers your housing goals and your homeless goals that you may use home for. So the question about how do we submit a plan for our home portion, that home portion is done by the lead grantee with your input. And the fact that the goals overlap, we accounted for that by creating one set of goals by combining both the templates for the non-housing community development plans with the template for the lead grantee, and they're all submitted together.